So, our next module is about joints. First is introduction. So, joint is also known as what? The articulation or arthrosis. It is a point of contact between two or more bones, which connects between the cartilage and bones or between the teeth and the bones. So the biological study or the scientific study of joints is also known as what? Arthrology. So joint holds bone together but also provides what? Movement. So the point of contact between two bones, between cartilage and bones and teeth and bones. So the attachment point of the joints can be between two bones, between the cartilage and bones, or between the teeth and the bones. And the study of joint, as I have previously mentioned, that is the arthrology, and the study of motion is kinesiology. So, what are the classifications of bone? The classification is based on the structure, based on the presence or the absence of the synovial joint cavity. So structurally, joints are classified into fibrous joint, cartilaginous joint, and synovial joint. And with the respect of the functional classification, it depends upon the movement of the joint. First is the immovable joint, that is synarthrosis. Next is slightly movable joint, that is the amphiarthrosis. And thirdly is the freely movable joint, that is diarthrosis. So these are the fibrous joints. So these fibrous joints actually, in absence, it actually lacks what? The synovial cavity. So the bones are closely attached by the connective tissue, which is made up of fibrous element. So there is no movement or slightly movement occurs. That can be explained in synarthrosis or amphiarthrosis. There is three structural types of fibrous joint, that is sutures, then the syndesmosis and gomphosis. So sutures are present in the skull bones. The syndesmosis are present in the lower limb bone, that is in between the fibula and the tibia, and the gomphosis are present between the tooth and the socket. The sutures. So sutures are the thin layer of the dense fibrous connective tissue which actually helps to attaches the bones of the skull. So these are actually immovable type and are known as what? Synarthrosis. Then comes the syndesmosis. Syndesmosis are the fibrous joint which actually is united by the ligament, and they are slightly movable, and they are found in the tibiofibular joint and the interosseous membrane. So this is the interosseous membrane and this is the tibia and fibula ligament. So this is the ligament present between the tibia and the fibula. Then comes the gomphosis. So gomphosis actually helps in the confinement of the joining of the teeth with the bony socket. So these are immovable and teeth in alveolar processes. Then comes the cartilaginous joint. So this actually are in absence of the synovial cavity. There is no movement or a minimized movement is present, and they are actually tightly joined by the cartilaginous fibrous element or known as the hyaline cartilage. They are of two types, that is the synchondus and the symphysis. So synchrondosis is this type of bones are the synchrondosis, which is the connecting element is the hyaline cartilage. So these are the hyaline cartilage present. These are mainly immovable in nature, and emphyseal plate. So this portion are the emphysis, and the plate between the emphysis are the emphyseal plates, or known as the joints between the ribs and the sternum. Then comes the symphysis. They are actually present in the invertebral disc and the pubic symphysis. So this is are present in the pelvic girdle area, that is pubic symphysis in this region, that is in the hip bone region. And next is the in the vertebral disc. Between the two vertebral body, there is a vertebral disc which is having a symphysis joint. Then comes the synovial joint. So the synovial joints are helps in the attachment of the two bones, and they are having an articulating bone above and below, and they are having a articular capsule. Inside the articular capsule, they are having synovial membrane. This synovial membrane actually secretes the synovial fluid. This synovial fluid helps in the prevention of the bone erosion between the two bones during the movement, and also helps in lubrication. So this synovial membrane is the lining of the capsule. So these are the articulating bone. This is the synovial joint. This is the cavity containing synovial fluid, articular cartilage, articulating bone, synovial membrane, articular capsule, and fibrous capsule. Example of synovial joint. So there are example of synovial joint, that is the articular capsule is having. This joint space is having synovial joint cavity, articular cartilage covering ends of bone, and articular capsule. So this is a microscopic view of the synovial joint, which is present between the two bones. So this articular capsule actually surrounds what? Surrounds a diarthrosis, which encloses the synovial cavity and unites the articulating bones. So they are composed of what? Outer fibrous capsule, which contains ligaments, and inner synovial membrane, which secretes the synovial fluid or lubricating fluid. The flexibility of the fibrous capsule permits the movement of the joint, whereas its great tensile strength helps in prevent the bones from the dislocating. Other capsule features include ligaments and articular fat pads. So the synovial membrane actually secretes what? Synovial fluid, and this actually composed of a chemical substance, that is the hyaluronic acid. So this hyaluronic acid brings the nutrients to the articular cartilage. Then comes the blood supply and the nerve. So the joints are actually having nerves which are branched off nerves and nearby attaches to the muscles. So these nerves actually takes the signals from the outer stimuli, and it sends to the muscle for the contraction and relaxation. So the joint capsule and the ligaments contain pain fibers and sensory receptors. So whenever there is a fracture of any bone, so this nerve actually impasses this sensation, and that causes what? A pain-like sensation. Then comes the blood supply to the structure of the joint are branches from the nearby structure. So this blood actually supplies what? The nutrients to the all the joints except the articular cartilage, which is supplied from the synovial fluid. So this blood supply actually provides the nutrition to all the joints tissue, but this articular cartilage is nutrition is supplied by the synovial fluid. Types of movement at synovial joints. Gliding joint movements occur when the relatively flat bone surfaces move back and forth and from side to side with respect to one another. In the gliding joint, there is no significant alteration of the angle between the bones, and it occurs at the plantar joints. Then comes the angular movement. Angular movement, there is an increase or decrease in the angle between the articulating bones. So when there is a movement between the two bones, there can be a increase or decrease in the angle position. So flexion results in the decrease in the angle between articulating bones, and lateral flexion involves the movement of the trunk sideways to the right or left at the waist. Then comes the extension, which is an increase in the angle between the articulating bones. Hyperextension is a continuation of the extension beyond the anatomical position and is usually prevented by the arrangement of the ligaments. So these are the example of the flexion, that is the movement of the body away from the midline, that is the flexion to the front side or the upside. Then extension is the movement of the body parts away from the midline to the back side. And hyperextension are the continuation of the extension movement. So this is the extension, this is the flexion in case of the lower limbs. In case of the upper limbs, this is the flexion and this is the extension. For the palm region, this is the flexion, extension and hyperextension. And for the whole body, for the upper limb, this is the hyperextension, extension and the flexion. Flexion is always in the front side or the frontal movement. Extension is always the backward movement, and hyperextension is always the continuation of the extension movement, and which is not generally a common movement and it is impractical. Then comes the abduction, adduction, and circumduction. Abduction refers to the movement of a bone away from the midline. Adduction refers to the movement of the bone towards the midline. Circumduction refers to the movement of the distal end of a part of the body in a circle. And condyloid and saddle and ball and socket joint allows the circumduction. In rotation, a bone revolves around its own longitudinal axis. So this is the abduction. This is the adduction. So suppose this is the midline. So what happens? Adduction is coming towards the midline. Abduction is going away from the midline. So in this case, this is the abduction and the adduction. Then comes this is the abduction and this is the adduction. And for the lower limb, this one is the abduction and this is the adduction. So this is the circumduction, which is the circular movement of the joint for the upper limb, and similarly this is for the lower limb circumduction. Pivot, ball and socket joint permit the rotation. So pivot joint actually present in the axial part of the human skeleton system, which forms the movement of the head, and the ball and socket joints can be seen in between the femur and the pelvic girdle or the humerus with the scapula. Then comes the rotation. There is a medial rotation and the lateral rotation. So medial rotation is the turning of anterior surface in towards the midline. So it is going towards the midline of the body, and the lateral rotation is going away from the midline. And special types of movements are elevation, that is upward movement, depression, downward movement, protraction, that is a movement of the part of the body anteriorly in the transverse plane. Retraction is the movement of the protracted part back to the anatomical position. Then comes the special movement of the mandible. That is the mandible, that is the lower jaw, is movable in nature. Only a type of bone of the skull that is a movable bone or movable. That is, mandible can have a special type of movement, that is elevation, depression, protraction, and retraction. That is, elevation is upward, depression is this one is downward, protraction is going forward, and retraction is backward. Special hand and foot movement. There is an inversion that is going towards the midline, eversion of the foot that is the going away from the midline. Then comes the palm movement, that is a supination and pronation. So the palm, when is moved to the anterior portion, anterior side, that is a supination, known as supination. Palm when is facing toward the posterior side, that is the pronation. Then comes the toe movement or the feet movement, where there is a two type of movement, that is the dorsiflexion and the plantar flexion. The dorsiflexion is going to upward and the plantar flexion is going away from the midline to the normal position. Then comes the planar joint. So this type of joint bone surfaces are flat or slightly curved. Side to side movement is only possible. So this is the side to side movement. Rotation is prevented by the ligament structure. The examples can be the vertebropostal joints, the intercarpal and intertarsal joints. Types of synovial joints, another is the hinge joint or the hinge joint, which is this one. So it is a convex surface of one bone, convex surface of the one bone attaches or fits into a concave surface of the second bone. This is the convex surface and this is the concave surface of the second bone. Uniaxial, that is one direction like a door hinge. Examples are the knee, elbow, ankle, interphalangeal joints. Movement produced are the flexion, decreasing the joint ankle, extension, increasing the angle, hyperextension, opening the joint beyond the anatomical position. Then comes the pivot joint, that is the rotational movement. So there is a round surface of the bone which actually articulates a ring form by with the second bone with the ligament. So this is a monoaxial, since it allows only rotation around the longitudinal axis. The examples are the supination, pronation, and atlantoaxial joint, turning head side to side, that is no. Then comes the condyloid joint. So this condyloid joint is also known as ellipsoidal joint, which is oval in shape. Projection fits into a oval depression. So two types of bones are articulated. One is oval shaped, which is fit into a oval depression like structure of the bone. So the examples are the wrist and metacarpophalangeal joints. Then comes the saddle joint. So the saddle joint is one type of bone is having a saddle shaped, and other bone fits as a person. That is the saddle which is present. For example, a saddle is a substance which is used for the sitting over a horse. So in this bone, what happens? One bone is like a saddle shape, where another bone actually fits into that saddle shape like a person is sitting in that saddle. So the examples are the trapezium of carpus and metacarpal of the thumb. Then comes the ball and socket joint. Ball and socket joint are the ball type of joint which is fitting into a cup like a hollow surface or hollow bone. So a bone which is having a ball like structure in the upper portion of the head, which is getting fit into a cup like hollow structure. So it is a multi-axial. So means what? That it can move to different direction. That is, it can be followed by a flexion or extension, abduction or adduction, or rotation. So there is two types of example of joint is present, that is a shoulder joint and a hip joint. Then comes the shoulder joint. So this shoulder joint is a head of humerus and glenoid cavity of the scapula. So this is the head of the humerus and the glenoid cavity of the scapula. That is ball and socket joint. So all types of movement can be possible in this respect of the shoulder joint. Then comes the glenohumeral joint. It is an articular capsule from glenoid cavity to the anatomical neck. Glenoid labrum steepens the socket and many nearby the bursa, that is subacromial. So it helps in what? The ligaments holds what? The bicep tendon in the place, and it helps in strengthening the joint capsule. Rotator or cuff muscle. It helps in attachment of humerus to the scapula. It encircles the joint for supporting the capsule. Hold the head of the humerus into the socket. Then comes the elbow joint. So elbow joint are having a lateral aspect view and the medial aspect. So the radial annular ligament hold head of the radius in place. So there is two type of ligament, that is the radial annular ligament and the collateral ligaments. These two type of ligaments actually helps in the integrity of the joint. Then comes the hip joint. Hip joint follows what? A ball and socket type of joint. And here every type of movement can be possible. In this hip joint, what happens? The head of the femur is actually attaches with the hip of the bone, that is the pelvic girdle. Then comes the knee joints. Knee joint is also known as the synovial joint, and it is divided into tibiofemoral joint. It is present between the femur, tibia and patella. Hinge joint between tibia and femur occurs. Gliding joint can occur between the patella and femur, and there are different types of movement that can be possible. That is the flexion, extension, slight rotation of tibia on femur, and when the knee is flexed. Tibiofemoral joint. So tibiofemoral joint is the articular capsule mainly present in where? The lateral medial menisci. Factors affecting the contact and range of the motion at synovial joint: structure and shape of the articulating bones, strength and tautness of the joint ligaments, arrangement and tension of the muscles, contact of soft parts, hormones, disuse, aging and joints, various aging effects on joints, including decreased production of the synovial fluid, which can lose the ligament length and flexibility. It can affect the aging on joints are due to the genetic factors as well as wear and tear on joints. So next term is the arthroscopy and arthroplasty. So what is arthroscopy? So this is a study or examination of the joint, which includes instrument size of pencil, remove torn knee cartilage, repair ligaments, small incision only. Arthroplasty is the replacement of the joint, where total hip replacement can be done. Then plastic socket and metal head, knee replacement is very common. So what are the bone disorder? First and most common is the osteoarthritis. So this is a degenerative joint disorder commonly known as wear and tear arthritis. It occurs when there is a deterioration of the cartilage or the articular cartilage, and it causes what? It is a non-inflammatory and primarily affects the weight-bearing joints. Then comes the gouty arthritis. It occurs due to the sodium urate crystals, which is deposited in the joint tissue and causes inflammation, swelling, and in severe extent, and it can cause pain. Then comes the rheumatoid arthritis, which is an autoimmune disease where the cartilage are destroyed, and this can further lead to the inflammation, swelling, and pain. And final step is the fusion of the joint, where the joint can get fused and there is a lack of movement. Then comes the gouty arthritis. It is a urate crystals build up in joints and forms pain. It contains waste product of DNA, RNA metabolism deposited in cartilage causing inflammation and swelling. So this urate crystals actually forms a pokey nature which actually causes inflammation and swelling in the joint. And the bones actually gets fused, and it is mainly commonly seen in the middle-aged men with abnormal genes. So these are the references, and thank you.